Bronchiectasis. The bronchiectasis is defined as a disease in which there is a permanent enlargement of parts of the airways of the lung. The patient always complained of a chronic daily cough with a huge amount of sputum. So what does happen in the bronchiectasis? The bronchiectasis to occur, there are two major factors: infection plus airway obstruction, impaired drainage, or defect in the host response, which means immune deficiency, and the result is a chronic infection. The infection, which could be bacterial, viral, or fungal infection, cause an inflammatory response, and as we know, the inflammatory response include recruitment of the immune cells, neutrophilic proteases, and inflammatory cytokines or active oxygen will be secreted, and this cause a transmural inflammation, mucosal edema, and of course ulceration, which lead to a permanent abnormal dilatation and destruction of the bronchi. So the infection is the major factor for the bronchiectasis to occur, with other factors: obstruction, impaired drainage, or decrease the immunity. About airway obstruction, it has many causes like foreign body, tumors, hilar adenopathy, which can occur in the TB, sarcoidosis, rheumatic diseases, and the main rheumatic disease which cause bronchiectasis are rheumatoid arthritis and Sjogren's syndrome, and some congenital defect can cause the obstruction. A patient with foreign body presented with episode of shocking cough and unexplained wheeze, and the bronchiectasis that results from the foreign body aspiration generally occurs in the right lung and in the lower lobes or the posterior segments of the upper lobes, and the reason for that is the anatomy of the bronchi. As we know, the right main bronchi is more vertical, which make the foreign body easy to enter, compared with the left bronchi, which is more horizontal. About secretion or abnormal secretion clearance, it occurs in many diseases like cystic fibrosis, Cartigner syndrome or ciliary dyskinesia, and Young's syndrome. Cystic fibrosis, there is defect in the cystic fibrosis transmembrane conductance regulator gene, CFTR gene, which cause a ciliary dysfunction. About Cartigner syndrome, it's characterized by sinusitis, bronchiectasis, and dextrocardia. Young's syndrome, it's occur in the middle age, and it's like the cystic fibrosis, characterized by bronchiectasis, sinusitis, and obstructive azoospermia.